No, I guess
I said, I'm kind of confused. I thought, yeah.
maybe bring it
Fine, I'm not gonna.
Real-time updates on what's going on. $593, and that number represents 0.5% of the county's population. And further good news is that the number of residents that have received the second dose now numbers 4,464, and that number is 1.9% of the county's population. Some of the statistics that unfortunately we have 113 deaths to date since the COVID pandemic has struck Saratoga County. The number of recovered cases is presently 5,908. We're working on 4,283 active cases, and the number of hospitalizations at this point in time is at 70. The 7-day rolling average positivity rate in Saratoga County is presently 6%, and that's actually fantastic news because over the past 2 weeks we dropped our positivity rate by over 32%. So things are moving in the right direction. To date, the number of individuals that have been tested in the county now numbers 289,000. I'm sorry, number of tests now numbers 289,054 in the county. So you see the infection and hospitalization rates in the county are continuing to steadily decline. Needs to be done, and that's why we're putting forward additional efforts to accomplish those goals. Along those lines, Saratoga County Public Health staff has been working closely with BOCES to train their school nurses and staff to operate dedicated pods, and I believe, Doctor, we have one as a result of that training that's up and running today. The importance or the significance of that is that this has a multiplier effect that can be fully leveraged when Saratoga County is going out and seeking additional vaccines, and we're hopeful that that will lend itself to the county receiving additional doses because we have that additional capacity. Today I'm pleased to announce that Saratoga County has approved higher risk K through 12 sponsored school sports to resume on February 1st, which is the earliest that they can under the governor's directive, as long as schools meet certain sport-specific minimum requirements and communities meet specific COVID-19 metrics. This plan was authored by Dr. Kuhles and will not only be used here in Saratoga County as a result of Dr. Kuhles' expertise in epidemiology. His plan, working with his colleagues in other counties, in some form will be used in over a dozen other counties. So that's pretty impressive. We're very fortunate to have Dr. Kuhles here on staff in Saratoga County. Recognizing the important role sports activities have for youth's physical and psychological well-being, I have directed Commissioner Kuhles to study and investigate additional alternative approaches that could provide student athletes with a safe way to compete while also protecting the health and safety of our community, our healthcare providers, hospitals, and their staffs. Among the alternative approaches that Saratoga County is going to be looking at under Dr. Kuhles' direction is that we will consider ways to further our surveillance testing protocols. And we're looking, as a matter of fact, at the protocols that the NCAA currently has in place. And if we can adopt portions of that with the doctor's recommendation, we will do so. And as a result of the pressing need to get our students out and playing, I am calling a special Board of Supervisors meeting for Thursday, I believe it's February 4th, and have asked the doctor to provide recommendations for the full board's consideration at that time. So we want to get this as many kids playing as quickly as possible, and we believe that those efforts will lend itself to making that happen in a timely fashion. The other issue is, we talk about the health component of the COVID-19 pandemic, but as we all know, there's also a financial component to that. And recognizing that financial component, the day after I was sworn in as chairman of the Board of Supervisors, I sent a letter to Governor Cuomo requesting that because there's an executive emergency declaration in New York State that allows certain county executives or leaders to have additional powers, and under that ability, utilizing provisions in the real property tax law, I requested from the governor that he issue an executive order that allows our real property owners to have additional time to pay their real property taxes. That request was granted on January 27th, and it's contained in Executive Order 202.92. And Saratoga County is the only county that I'm aware of in New York State that made that request and received that executive order. So, we're being forward-thinking. We're considering all the financial impacts in addition to the health impacts on our residents, and we think that will provide assistance to some of our less fortunate property owners that don't have the ability to make those payments in a timely fashion. And what that does under state law, it allows those individuals an additional 21 days before they have to pay their property taxes without any penalties accruing. The other part of the plan that we're going to discuss today that impacts our residents from a financial standpoint is the ability of our low-income residents to be able to pay their rent in a timely fashion. And I'm pleased to report today that under the leadership of our DSS Commissioner Tina Potter and working with the County Treasurer Drew Jarash, we were successful in receiving a $6.8 million grant that can be used toward alleviating some of the hardships facing renters and landlords in Saratoga County. These funds will be utilized by villages and will go towards resolving back owed rent by lower income individuals. And I know that Drew is going to talk about that with Commissioner Potter shortly. But before we get there, I would like to introduce Commissioner Dan Kuhles to provide additional details on where we are with our K through 12 sports program. So, Doctor, would you like to step to the podium?
Thank you, Chairman. So this, our plan has been developed in consultation with subject matter experts from local health departments in the region and across the state, also with healthcare providers and other individuals. And as the Chairman mentioned, there are a set of minimum requirements that schools must meet and a set of community metrics that must be met. In terms of the minimum requirements for schools and districts, each school district or board of directors will need to approve the individual sports to be the individual sports for competition among the high-risk sports. Each superintendent must oversee the creation of a sports-specific preparedness plan, and that will need to be approved by the school medical director. Each parent or guardian must sign an informed consent for participation, and each student athlete must have a clearance to play from their healthcare provider. Importantly, all individuals associated with participation in these high-risk sports must agree in writing to fully participate with public health investigations, contact tracing, isolation, and quarantine requirements. And they must also establish a confidential hotline for parents or other athletes or any individual associated with the school setting to report any concerns with adherence to these requirements. In terms of the community metrics, the 7-day rolling percent positivity as calculated by the state health department needs to be at or below 4.0%. If that metric has not been met, sports teams can still practice so long as they're restricting their activities to low contact or no contact group activities. The region's hospital capacity as calculated by the state health department, there must be greater than 15% of beds available, and the state health department must also have not designated that there's an unusual increase in the rate of admissions. We're also asking or requiring at the community level that there's an absence of any other epidemiological factors that threaten COVID control in the community, whether that's defined or identified by the Centers for Disease Control, the State Health Department, or here in Saratoga County by Public Health Services. So we think that this has provided the governor provided a road for these sports to continue or to restart. And we worked collaboratively with all the local health departments and other partners to put the guardrails on there and appropriate safeguards so that both the schools and the students can participate safely and that we protect our communities and our hospitals and our healthcare workers as well. Thank you.
Thank you very much, Doctor. We're also joined by Supervisor Tollison in the back of the room, and I believe Supervisor Lant is also with us this afternoon. Didn't want to leave them out. I touched a little bit about the importance that sports have in our students' and youth lives, our children's lives. And I would like to ask Supervisor Barrett, who has within his township one of the county's largest school districts. I know he's been working very closely with the school district, just to add some comment regarding K through 12 sports and the impact it has in the community. So Supervisor Barrett.
Thank you. Thank you, Mr. Chairman. Appreciate the opportunity. I think as Dr. Kuhles mentioned, you know, this announcement as far as high school sports is a yes with parameters. And let's face it, everybody has been negatively affected by the pandemic in some way. There's no doubt about that. And what the county has done over a period of time is help as many people as possible, as efficiently as possible. Whether it's our senior population, businesses, small businesses throughout the county with grants, the dissemination of personal protection equipment directly in the hands of people in our communities and people who live in senior housing complexes. I could go on and on. We have the new rental assistance program, and I want to thank the staff that's done a great job on that, along with Chairman Kusnierz. So there's a lot of, like I said, everybody's been negatively affected. But we're here today to talk about our kids, our student athletes, and not just the athletes. It's kids that are involved in every facet of school life and community life. So today we're going to talk about athletes, but I think a lot of what we're talking about should also pertain to our students that are involved in other very important facets of who they are and what they do and what they want to be. And it could be Boy Scouts, Girl Scouts, it could be theater clubs, whatever the case may be. Our kids need the opportunity to get back to normal as quickly as possible, pursue their dreams, and live out what they expected as part of their high school career. This is particularly important for seniors. Our seniors last year and now our seniors this year are missing out on so much. So we need to work with our public health officials. There's no doubt about that. And Dr. Kuhles, I understand where he's coming from and the plan that he's been working very diligently to put together. He has to think of not only our student athletes, but our families, our healthcare system, the greater community. And I know he's doing that to the very best of his ability, and we support his continued efforts. But we also need to look at options on how we can get our student athletes back on the field, back on the court, back on the wrestling mat, back on the football field, across the board. So how do we do that? We do that by providing an option, as mentioned by Chairman Kusnierz and Dr. Kuhles, which would be through an NC or a college-style testing program. It would be an option that the individual school districts would have the ability to enter into in partnership with the county. It is one way and an important way for our kids to get back to playing sports and pursuing their dreams. And it's more than just the memories. It's their current physical and mental well-being that's so important. But boy, those memories are sweet too. The camaraderie, the life lessons, the friendships you'll have your entire life. All made because you were involved with a sports team. And you went with your team on the field to compete and work hard every day to get better as a team. And those are just some of the reasons, but there's so many reasons why our kids need to get back to the fields. Now, my son was very fortunate. He and his fellow soccer players had a successful and safe fall season. So it has been proven it can be done. And my son attends Shen. I am in the Shen district. They did a great job. They did a great job making sure that the kids could get through the year safely, effectively. And it was a shortened season. They didn't have the opportunity to pursue state playoffs. But boy, they had a rewarding season. So we know the schools can do a great job. They're all professionals. And we have the utmost faith in the schools, the athletic directors, the coaches, the parents, and the student athletes themselves. From what I'm hearing from them, what they're willing to do to make sure that they stay as safe as possible as a group, they're ready to go way above and beyond what other segments of our community, I think, are doing, and I applaud them for that. It's another reason why they should be rewarded by getting back on the field. Now, I do want to say, I've spoken with Dr. Kuhles about this because I think it's important that we give a little bit more information. Obviously, the parameters that were laid out were very important. This testing program that will be something that school districts can opt into in partnership with the county, very important. The county purchased a testing machine, COVID testing machine, in 2020. We made that investment. It's paid off in many ways. This is another great way for us to utilize that machine to help our community. But I want to talk a little bit about practice too, because I understand as a dad of athletes, as the season progresses, you have to have so many practices before you can play games and such. But it's also important to make sure that we disseminate the parameters as far as practice is concerned, starting on Monday. And really on Monday, teams can practice, but it has to be at a low-contact situation, okay? So they can return to practice, but it cannot be a high-contact situation. Once this, and obviously we're moving as quickly as possible. You heard Chairman Kusnierz say that we're going to have a special meeting of the Board of Supervisors next week. Once the testing program is in place and schools have opted to partner with the county, at that point, teams can begin high-contact practice and also resume games. And that's why this testing option and program is so important, because it'll allow our student athletes to get back to the field and the courts sooner than they otherwise would have. And again, I applaud Dr. Kuhles for working on this, Chairman Kusnierz for moving this initiative forward with a special meeting next week. We will need the cooperation from school districts, athletes, parents to make this work. And if we all work together, our student athletes will be able to return quickly and enjoy the successful season that they deserve. So with that, I'll hand it back to Chairman Kusnierz and thank him again for his support.
Thank you very much, Supervisor Barrett, for those strong and pointed remarks. I couldn't agree more. And the sooner that we get our student athletes out on the fields, it'll just be a brighter day for family and the students and no time at all. I touched on it a little bit about the significance that we have a multifaceted approach to COVID here in Saratoga County. It's not just about the vaccine. There's other components, one of them being financial. And I also mentioned the Emergency Renters Assistance Program that the county was very fortunate in receiving $6.8 million in funding. And at this time, I'd like to ask the County Treasurer, Drew Jarash, and Commissioner Tina Potter to come up and maybe touch on that in greater detail. Thank you.
Thank you, Chairman Kusnierz. I am very happy to announce that several weeks ago, when Congress passed and the President signed the CARES 2 Act, the second stimulus bill, in there was allocated $25 billion for counties and cities across the country with populations over 200,000 to use towards resolving the back rent owed by lower income families, lower income renters. Saratoga County, very glad to announce that through our Commissioner of Social Services, Tina Potter, we applied and we were granted the use of $6.8 million for this Emergency Renters Assistance Program. This financial influx will greatly impact the economy of Saratoga County. It'll assist those that are most in need, alleviate some of the financial impact that this pandemic has had all over the county. As Supervisor Barrett said, there's not a single person in this county, probably in this country, that has not been negatively impacted by this pandemic. And as Chairman Kusnierz said, this is one facet of how we are acting and how we are responding to try to help alleviate some of those hardships. The federal guidelines for this program are that renters who earn less than 50% of the median income in Saratoga County and who have experienced financial hardship due to the pandemic, they're going to work in tandem with their landlords to apply for assistance through this program. As of right now, there's not yet a defined application, a process, or a procedure. Saratoga County, along with several other counties that also received this similar emergency renters assistance funds, we're working closely with the New York State Office of Temporary and Disability Assistance to develop an online application portal that will be utilized by all New York State residents that are eligible. We will, of course, be working with many aspects of the Saratoga County community, including not-for-profits and other county organizations, to reach out to renters and to landlords and provide application assistance once the state application portal is up and operational. Our primary concern here in Saratoga County is that the families and the taxpayers that are most needing of these funds and this assistance are the ones that receive them. We want to distribute these funds as quickly and responsibly as possible. Our expectation right now is that the state online application portal could be up and running in as little as 6 to 8 weeks. The federal guidelines for this program require that we distribute 65% of our $6.8 million by September 30th of this year, and the remainder to be distributed by the end of the year. And we fully expect and intend to hit and even exceed that target. While we're waiting for New York State to develop the online application portal for the Emergency Renters Assistance application, I want to encourage all eligible renters in the county to start work now. If you want to apply for some of these funds, start working with your landlord, start gathering some background, some basic information like a copy of your lease, a copy of your rent agreement, some income verification, a few of your last pay stubs. If you're out of work, maybe, and you're on unemployment, that instantly qualifies you for this program, so gather up your unemployment paperwork. Your W-2 that you just got in the mail, keep a copy of that because that'll probably be required as well. We don't yet know what other documentation New York State is going to require, but I'm encouraging our residents to start getting prepared now. These are documents that are most likely to be required, so the more work you can do now, you'll be a couple steps ahead when that online portal is up and running. Over the next few weeks, as we get a better sense of when the application will be ready, we will again reach out to our community through the media, through social media, through some of our outreach programs and organizations, and we will be updating you. While I'm expecting calls to come into us, please understand that there's no need to call us just yet because we're waiting for the state and their application portal to become operational. And as we get more details and as we start filling in the details for this program, I will make sure, Tina Potter will make sure, Todd Kusnierz will make sure that everybody in Saratoga County is aware of how to apply for these programs, for this assistance. Thank you very much.
Thank you very much, Treasurer Jarash. Again, in summary, not only are we doing everything we can to get our residents vaccinated in a timely fashion, there's other ways that we can help our residents, and you heard today some of the things that we're working on. So at this time, I'll open it up to anyone who may have questions.
You said there were 19,000 residents who've been vaccinated. Do you have a breakdown of that between medical personnel, essential personnel, senior citizens?
I do not have it with me. Maybe Dr. Kuhles could answer that.
Does that information exist, Doctor?
I can get you that number.
Approximately how many vaccines is the county getting a week?
So I know that our vaccination amounts have been significantly decreased, but I believe Dr. Kuhles has this week's number.
So, as you may be aware, we are required by New York State to deliver vaccines to populations that they direct us to use them on. In general, local health departments are directed to vaccinate essential workers, such as law enforcement, first responders, and teachers. We received 300 doses of vaccine for that population this week. Additionally, and unexpectedly, we received 400 doses of vaccine for 65 plus, those that are medically frail.
Talk about, some counties have taken it upon themselves to create wait lists or sign up some elderly people because pharmacies have not been ready to handle the demand yet. Can you talk about where the county stands with trying to get these vaccines out to the elderly?
Yeah, absolutely. As a matter of fact, we were made aware several days ago that we had an allotment, a special allotment of vaccine doses that could be utilized for those 65 and older. And there were parameters that are attached to that when they had to be used. And we as collectively, a group of supervisors, each town had the ability to have access to those vaccines that were not being utilized in a timely fashion and allocated to, i.e. pharmacies. And, we have the ability to get them out there quickly, and we're doing that.
Got two questions for the doctor. Locally, the capital region, predominantly, most counties have gone with 4% rolling average. 28 other counties in New York State have decided to go ahead with high-risk sports without a matrix, without utilizing the 4% number. Just as a healthcare official, just your opinion on what other counties throughout New York State, their decision.
My focus is on Saratoga County, and so the plan that you have there with you is our determination as to what's best for Saratoga County.
In regards to utilizing a metric, on the same page that we can see the daily metric in a multitude of counties over 4% matrix, there is the option to look at a school district's current 7-day positivity rate. You look at the school districts, which is where the K through 12, this directly impacts. The numbers are percentage of a percentage. Idaho, as an example, has been 0 for the past 2 days, has never been above 0.54. Was there conversations about taking a hyper-local look at a positivity rate in that community itself, a building, a population, versus a broad county, which is several hundred miles large?
So, teams draw, school districts in different sports draw from different areas. Some have combined teams. Some school districts have, students from different counties, and they also travel. Furthermore, we also need to balance the concern of the community as a whole. Parents may live in one area and work in another part of the county or in another part of the county, and so this is this we feel is a good balance to allow high-risk sports to continue and also protect the health and safety of our county residents and, importantly, our healthcare system as well.
Dr. Kuhles, can you take us through the scenario of what has to happen now in the next day, 2 days, 3 days, 4 days, before athletes are allowed onto a court, onto a wrestling mat, those sorts of things? Practically speaking, what is the advice to parents as resumption of high school athletics comes together?
So the initial, the process that's required really starts with the school districts. And they must they must make a choice. Those school boards must make a choice as to whether they want to sponsor each higher risk sport. And the next step after that is they need to create a sport-specific preparedness plan. That plan needs to be approved by the school medical director. Parents have the option, which is always, I think, a good thing, on whether or not they want to allow their student to participate in that sport. And in order for them to participate, they need to do a few things. They need to have a medical clearance from their primary care doctor, an informed consent. School physical not required for this. It's really making sure that the parent has all the information that they need in conjunction with their child's health care provider to make the best choice they feel for them and for their families. And again, they also need, all the students, the coaches, and the school districts need to agree to fully participate in all public health investigations, and including case investigation, contact tracing, isolation, and quarantine. Further, they need to establish a confidential hotline so that any parent or player or other individual associated with the school can confidentially report concerns to this hotline, and when indicated, that needs to be reported to the public health authorities.
Is this something you anticipate can get up and running in just a couple of days?
I think that's a question you should direct to the school districts. I know they've been preparing.
With that extra allotment for seniors, how are you determining which seniors it goes to? And do you have a list for future if you were to get more special allotments down the line?
I'll take that, Doctor. Very good question. So the individuals that know their community the best, I dare say, are the supervisors. And they know who is most at need, who is homebound. They're in close contact with the community centers, their senior centers. They know who those people are, so that when we get a one-time or a two-time limited amount of vaccine, they know who are those individuals who are most at risk. And so they are relying, I can tell you from the town of Monroe's perspective, we have a community center with a senior division. I reached out immediately when I realized that there would be available vaccine in a limited supply. They work with these individuals on a daily basis. I don't, and so I took whatever names they submitted and compiled a list and provided it to the county.
Any update on a possible vaccination clinic, whether it's the city center or other sites?
I'd love to provide an update if somebody could give us an update on where we are with vaccines.
So, Chairman, you said this would take effect February 1st, but I'm confused. You said a special meeting February 4th. The special meeting is not necessary for this to go forward?
No, it is not. I mean, that's totally up to the, in Saratoga County, the Commissioner of Public Health. What the purpose of the special meeting is for, a lot of folks are focused on that 4%. And so what I have done is directed the Commissioner to look at some other matrices, i.e. Maybe borrowing parts from NCAA. That will give us some flexibility there so that we can move forward in a quicker fashion.
And how will testing take place for student athletes? Will it be a daily thing?
So that will be part of the conversation, and that'll be a recommendation that the Commissioner will present to the board.
And Commissioner, is that your recommendation, daily testing for student athletes?
The chairman has directed me to investigate alternative possibilities. I will look at all the available literature and report to the board on Thursday.
Commissioner, you mentioned just a concern about community spread going beyond just the schools, but a lot of these schools, if they do get the chance to play, are going to in turn go to other counties and play schools from different counties just based on their school size and things like that. Are you concerned at all about the potential spread? Is there a way to find a way to mitigate going across county lines when rates are changing, obviously, between these counties pretty rapidly?
I think that's a question that may be better served for the School Athletic Association about their scheduling practices. this plan is, has many counties in the area have agreed to these metrics and this approach, and that was an attempt to address those concerns and unify our approach.
In regards to the possible NCAA-style testing program, Board of Supervisors will meet, hopefully come up with a plan to make it available. How soon can these school districts, these athletic directors in Saratoga County, how soon can they get in line to say, if you're a go, we're right with you, and start disseminating that information? So how soon for a sign-up potential for these school districts, and how soon for something to get off the ground in testing?
Well, I'll let the doctor talk to part of that, but the reason we wanted to mention this today was to give everybody an opportunity to prepare. So obviously, once the word gets out to the school districts, I would think they're already going to start those conversations internally. Is this something that we want to get involved with? They don't have all the details yet, and we understand that. But the basic parameters are there. And it's something that's used on the college level with regular testing. And I know there's some situations where schools have had to, I think Albany had to postpone a couple of games. We're hoping if we can keep the rates down, and as Chairman Kusnierz said, the rates have gone down about 32, 35%, somewhere in there in the last 2 weeks. So it's going in the right direction, and it's going in the right direction in schools, as you, Stan, pointed out. So with all that going in the right direction, we believe having this testing plan will get the kids playing high contact again quickly, as opposed to just the low contact practice that they can start Monday. And I want to make sure we don't forget about that point, because they can return to the court Monday. But it'll also ensure that there's a safety measures in place, there's parameters in place, and that testing will be there as these rates are going down. So what we're hoping is if this program can get in place quickly, that it's going to tell us good news. And it'll show clearly that kids can get back to playing sports safely. I think we've proven that can be done at other periods of the year, and we aim to prove it going forward. As far as the remainder of that question, I'll defer to Dr. Kuhles.
Yeah, so as I mentioned earlier, I'll be, examining literature, reaching out to officials that have worked with the NCAA program, and gathering data, and we'll make a recommendation to the board as I've been directed.
And then I know you said county program partnering with the school districts. I take it it'll be part of Thursday's conversation. Costs going back to the schools, first blush.
So that was actually something we tentatively we did discuss last night. Every option's on the table. We have some wealthier school districts that would pay whatever it takes to get their students back on the fields, back on the courts. Other parts of the county, we have school districts that are less fortunate, and there's different ways that we can assist in that. One of them you heard about utilizing the previously purchased Rainix machine. Do we need to hire more staffing to run it for longer periods of time? Maybe we look at a matrix similar to school lunches, where there's reduced and free school lunches. Maybe that's a part of the equation, and maybe the county plays a role there. So all options are on the table. We're sensitive to that, and I'm confident we'll come up with a workable solution.
Will you make sure that obviously every school will get an equitable opportunity for testing, whether they can afford it or not? The county will be able
Absolutely.
Chairman, will there be spectators at high school athletics?
That's a good question. You want to handle that, Doctor?
Sure. So that's covered in the plan. That's a determination for the school districts to make. Whatever they can certainly be more restrictive than the state guidelines, but they have to follow those state guidelines.
And do they, for the
They need to be approved by their school medical director,
Not the county.
not the county.
Thank you, Doctor. Any other questions? Great. Thank you very much, everybody. Appreciate your time this afternoon. Okay.